Hello, this is Jeff Swenson speaking to you again from Salt Lake City, Utah. We'd like to take a few minutes to talk about the saphenous nerve block below the knee. The saphenous nerve below the knee can be a little hard to get, much like this cow moose that we see in this picture being chased by the bull. And to understand why that can be, we're going to look at anatomy. This is a dissection of the inside of the left thigh. And we're going to start off by looking at the anatomy of the saphenous nerve above the knee so that we can understand it below the knee. The femoral nerve and the femoral artery, shown here on the left side of the screen, in the middle aspect of the thigh, pass in a compartment known as the adductor canal. And the adductor canal is formed by two muscles, the vastus medialis and a confluence of the adductor muscles, namely the adductor longus brevis and magnus. As the adductor muscles travel more distally, they form a very dense fibrous tendon that attaches to the femur. And at the point, the most distal point of the tendinous insertion of the adductor muscles, the saphenous nerve leaves the adductor canal, passes over the tendinous insertion of the adductor muscles, and between the vastus medialis and the sartorius, which has been reflected inferiorly in this picture, and also passes deep to a structure known as the pes anserinus. We're going to now go below the knee and look at the anatomy. This is distal. Now our scissors represent the saphenous nerve passing deep to the pes anserinus and in close proximity to the saphenous vein. The relationship between the saphenous vein and the saphenous nerve is very important because it changes above and below the pes anserinus. Here we see the saphenous vein traveling in close proximity to the pes anserinus and the saphenous nerve, but the relationship is very important, as we will see in just a second. So the pes anserinus is a confluence of the tendinous insertions of the sartorius, gracilis, and semitendinosus. I've outlined it here by this red box, and if you look at the inferior aspect of the pes anserinus, right where the tips of the scissors are coming out, you see two structures. One is the saphenous nerve, the other is the saphenous vein. Notice that as we go from distal to proximal, as we approach the pes anserinus, the saphenous vein and the saphenous nerve are both in the subcutaneous tissue below the pes anserinus, but at the level of the pes anserinus, the saphenous nerve dives deep to the tendinous insertion, or deep to the pes anserinus, and the saphenous vein stays in the subcutaneous tissue. So it's really important, if you're trying to block the saphenous nerve and you're using the saphenous vein as a marker, you need to be distal to the pes anserinus. And we've shown on the inset picture here on a real leg where the pes anserinus, what it looks like on gross anatomy and surface anatomy. So a common misconception is the way the description of a saphenous nerve block is described in some regional anesthesia textbooks, where they describe infiltrating across the tibial plateau just distal to the inferior pole of the patella. And this will certainly give you a block of the infrapatellar branch of the saphenous nerve, as shown here. But you can see that the distal saphenous nerve, which is what you need to anesthetize the foot and the lower extremity, will not be blocked by this method. So a really nice way to block the distal saphenous nerve is to use the saphenous vein as a marker. Make sure that you're distal to the pes anserinus, and then inject in close proximity to the saphenous vein, distal to the pes anserinus. So we're going to look at this next slide, and we have three pictures. The top picture is an ultrasound of what the saphenous vein looks like in the subcutaneous tissue. So it just looks like a hypoechoic space within subcutaneous tissue. How do you find the saphenous vein? Well, you position the probe, as seen here on the lower left inset, distal to the pes anserinus, and it's really important to only use very, very light pressure with the transducer, because you can compress the saphenous vein with the slightest pressure of the transducer. So it's important to use a very light touch when looking for the saphenous vein. Also, if you look at the right hand dissection, you can see that I have the black marker as an illustration of where the transducer might be. To find the saphenous vein, if you cannot find it easily just by looking on the medial aspect below the pes anserinus, you can go down to the ankle where the saphenous vein is very visible and keep the saphenous vein in view, and then move your transducer proximally till you get to the point just inferior to the pes anserinus. So that's a real nice way to follow the saphenous vein up, and then you know that the saphenous nerve is in immediate proximity to the saphenous vein. More often than not, you will not see the saphenous nerve at this level on ultrasound, but you can achieve a saphenous nerve block by infiltrating, as we see in this ultrasound picture, by infiltrating around the saphenous vein and getting a broad distribution of local anesthetic in the proximity of the saphenous vein. Here, as you see, after our injection, we have a broad area surrounded with hypoechoic local anesthetic in close proximity to the saphenous vein. This technique, although is effective, is not 100% effective, and it's not as reliable in our experience as blocking it above the knee, but it's a nice technique to have to know in case you need to block it below the knee for whatever reason. So in our next lecture, we'll talk about how to block the saphenous nerve above the knee. Thank you.